Greetings and welcome, everyone. I just want to say how appreciative we all are from the World Food Prize Foundation, the Iowa Hunger Summit, and the Center on Poverty and Social Policy that you could join us for this event. What we know about the Child Tax Credit and food hardship. My name is Kyle Porman. I'm the director of the Iowa Hunger Summit, also the director of international dialogues at the World Food Prize Foundation. I'm coming to you today from Des Moines, Iowa, at our beautiful Norman E. Borlaug Hall of Laureates. This digital event is really the start of a set of Iowa Hunger Summit and World Food Prize Foundation events we're planning for this summer and fall. Along with this event, we'll be hosting a listening session associated with the White House Conference on Hunger, Nutrition, and Health on August 2nd. It will be an hour-long virtual interactive session and will feed into the September White House Conference. We are also holding a day-long virtual Iowa Hunger Summit on September 1st. The theme of that event is Path to Zero, basically meaning path to zero hunger and greatly reduced non-communicable food-related disease. Both of those events are free and open to the public. I would also be remiss if I didn't mention that the Borlaug Dialogue, our flagship event at the World Food Prize Foundation, the in-person portion of that event goes from October 18th to the 20th here in Des Moines, Iowa. Please check our website for more information about the Hunger Summit or the Borlaug Dialogue or the many youth and other programs we have at the World Food Prize Foundation. Today, I'm being joined by two experts from the Center on Policy and Social, for the Center on Poverty and Social Policy, it's a mouthful, at Columbia University. Sophie Collier and Megan Curran. They are research and policy directors at the center. Both Megan and Sophie will be presenting on aspects of the Child Tax Credit. And we will be opening up questions after the presentations. So please use the chat and question and answer function to pose questions and have discussions throughout the webinar. The Child Tax Credit is one of those policies that has been on the top of my mind. And so when I was traveling to New York, I got to speak with Sophie, and we spoke a lot about the Child Tax Credit and the work that's being done on quantifying and the research on it. So that's why we brought both Megan and Sophie here today, and we're so pleased to have them here. So without further ado, I'm going to turn it over to Sophie and Megan.
Thank you so much, Kyle. Hi, everyone. My name is Megan Curran. If you'll bear with me for a second while I share my screen. Hopefully that's all looking fine. Great. So so thanks for that introduction. As Kyle mentioned, my name is Megan and my colleague Sophie will be on shortly, and we are from the Columbia University Center on Poverty and Social Policy. A quick word about who we are. We're a research group that is based in the Columbia School of Social Work, and we research poverty and how it affects, different communities across the country. And we also very specifically investigate the impact of policy decisions. And we do have a dual focus. So we look across the country, nationwide in the US, and we also focus on our home city of New York. So first, just to give you a quick overview of what we're talking about when we say the Child Tax Credit. So the Child Tax Credit is something that has been in place since the late 90s. Anyone on the webinar here who has children may have seen it on their tax forms, over the past couple of decades. But it really was functioned as a sort of pretty traditional once a year sort of either lowered your taxes in terms of what you owed, or you might have been able to get a small refund from it. But what happened last year in the American Rescue Plan, which was passed last March, was that the child tax credit was expanded really meaningfully in these three key ways that I'll speak about briefly, that actually turned it into something that was much more like a child allowance that you see in other countries, which is basically a sort of regularly paid out payment to families with children based on how many kids are in the home and sometimes depending on age or income of the household. And it's basically meant to, really kind of help families, cover the cost of raising children and have it be something that can be worked into your regular budgets rather than wait just once a year. So the American Rescue Plan did three important things. It increased the annual sort of maximum levels from what used to be a maximum of $2,000 per child to either $3,000 for older kids or $3,600 for young kids. It expanded eligibility to include those lower down in the income distribution who used to actually be excluded from the full benefit. Sophie's done a lot of really important research to show that 1/3 of all kids in the United States actually used to be left out of the full child tax credit because of the way that, it used to be sort of tied to how much a family earned. It really left out those who probably really would have benefited the most. And if you're talking about a place like Iowa, it was also close to 1/3 of all kids in Iowa. It varied across the country, but Iowa actually was similar to the national picture there. And it also, as I mentioned, delivered payments on a monthly basis. So it divided up that annual benefit into payments up to $250 or $300 per child per month. What happened in terms of the delivery is that it became a hybrid system for last year because the bill wasn't passed until March. The IRS was able to get sort of everything up in action about middle of the year. So the payments were in place for 6 months from July to December of last year. And then the balance, the rest of the sort of 6 months worth of payments was delivered just very recently at tax time in spring of 2022. What we saw with this sort of expanded eligibility is that close to, roughly 90% of all children in the United States were now eligible. And we saw that the payments reached, more than 61 million children, across 36 million households in the months in which it was available. And then when you got that lump sum, it was worth, sort of half of the value of the credit. What this did, these policy changes basically marked a really meaningful change in the way that, we support kids, we support families with kids in the US. It also then offered a real opportunity to actually try and track the impact and understand what the effects of actually, making such a flexible cash benefit available to so many more children and available on a very regular basis. So lots of research, started up across the country as soon as these payments started rolling out last summer, almost exactly a year actually this week. And including ourselves, we sort of mobilized as well to try and figure out what's the best way to figure out what these payments will do. And what we did, so we'll walk you through some of the key findings that would be of particular interest to this audience. But if you're interested in just kind of learning more in general, you can find a paper where we rounded up actually a summary of all the research that's kind of been out there. And there'll be 2 installments of it. So we have one that's been out there since last December, which talked about what happened, over the first 6 months. And we have a new version coming out very shortly. If you check back on our website, in the next week or so, you can find another one that says, 1 year after, what did we see? And basically, there have been impacts across a wide variety of areas. Our original research roundup identified, 8 main buckets. And, what I'll do is just spend, about 2 minutes speaking about the impact on family finances and measures like poverty. But then what I'll pass it over to Sophie to do is talk a little bit more specifically in terms of what we know about what these payments did in terms of helping keep families fed and, and the fact that it actually turned out to become a really important anti-hunger tool while it was in place. I should note that obviously, in terms of access, the payments did reach the vast majority of children who were eligible for it. But there were still some challenges, to ensure that some of the hardest reached families actually receive what they were eligible for. Because this was delivered primarily through the IRS and, it's a sort of functioning through the tax system, families who have very low incomes, and may not actually earn enough to be required to file federal taxes, weren't necessarily connected to the tax system in recent years. We saw this happen with the stimulus checks, right, in the last, in 2020 and early 2021 as well. And so, we have learned some very important lessons in terms of how we could do better outreach, how we could do better delivery systems, that hopefully if this type of program becomes a more permanent one in the future, we can, put those lessons into action. We also have seen, conversations about, well, how did this impact the economy in terms of, did it affect how parents were working or other types of decisions around the labor market? We found that actually there has been no evidence that these payments, had any sort of negative effects on parental employment. We saw this at the national level. Sophie will talk about what we saw in New York City. At the end of the day, these payments became a really helpful supplement to families' incomes rather than any sort of replacement. And it also has the potential to be a real tool for building equity, because as I mentioned, Sophie had found that 1/3 of all kids, had been left out of the child tax credit beforehand, before this expansion. That was actually 1 out of every 2 Black and Latino children. And so actually including them during this temporary expansion made it a really powerful tool to try and reduce some of those gaps that we usually see in terms of poverty and hardship and things like that. Our center has a particular focus on poverty. So of course, one of the biggest metrics that we started to look at immediately was, what would these payments do in terms of, could it actually get families actually above the poverty line? And we saw that it actually had a huge anti-poverty impact right from the get-go. The first payment back in July of last year actually kept 3 million children from poverty just with that very first payment. And the IRS was able to reach more children over that period of 6 months, and we saw that the anti-poverty effects grew. So the payments were keeping 3.8 million children out of poverty by November, 3.7 million children out of poverty by December. To see these gains, that type of anti-poverty reduction, it's not a traditional thing of what we see necessarily happening overnight in the US. And so it meant that the child tax credit was having a real impact on family finances. Places like JP Morgan Chase, Institute, who does research using sort of, anonymized data from all of their banking data, so that low-income families actually had a checking account balances that were $1,000 higher in the sort of late summer, early fall of last year than they were in that time of the year pre-pandemic. So, when families have more money available to them, more disposable cash, what did they spend it on? So some of the research that we saw from partners like the Social Policy Institute at St. Louis, and also the Center on Budget and Policy Priorities in DC, is that families first and foremost spent the child tax credit on basic needs, paying their bills, whether that was housing, clothing, utilities, education, what have you. But first and foremost, and this is nationwide and by state, because the Social Policy Institute actually looked at each individual state as well, the number one item that families used their child tax credit money on was food. And I have juxtaposed these two charts here because you can actually see that it happened all over the country, but it also happened across income levels. So families, all the way up to $150,000 were still spending it on food, first and foremost. And families who had very low and moderate incomes below $35,000 were also overwhelmingly spending it on food. Naturally, this then actually gets us interested in what this spending might mean in terms of hunger-related measures. Did we then see, food security sort of improve, and in what ways? So I'll turn it over to Sophie here just to walk us through some of those more specific food-related findings.
Yeah, thanks so much, Megan, and thanks so much for having me. So that direct spending on food that Megan just mentioned translated to a significant reduction in food insufficiency among households with kids. When the initial payments were made, our center launched several studies that examined the real-world impacts of the CTC on outcomes related to child well-being, including food insufficiency and others. And I'm going to walk through a few of our findings, beginning with, again, this look at food insufficiency at the national level. So since the onset of the pandemic, the Census Bureau has been monitoring food insufficiency across the country through their household pulse survey. And led by our colleague, Zachary Perlin, we leveraged this data to quantify the effects of the monthly CTC payments on food insufficiency, which is defined as sometimes or not often having enough money for food in the 7 days prior to being surveyed. And the results were quite powerful. This black line shows the rate of food insufficiency among households with children before and after the payments were made, and the red line signifies the date of the first payment. You'll notice a significant drop after the initial payment delivery, which actually amounts to a 25% reduction in food insufficiency among households with kids. We also show the rate of food insufficiency for households without kids. That's the gray line, just to ensure that the change we're seeing isn't actually associated with some broader population-wide improvement, but is the result of the CTC payments. And as you can see, the rates of food insufficiency in this period for households without children is relatively stable. So that reduction for households with kids can really be attributed to the CTC payments. If we could advance, please. I also want to note that these substantial reductions in food insufficiency were concentrated among households with less than $35,000 in income, as you can see from the image on the right. And that is, these are the families that, as Megan mentioned earlier, were those most likely to be ineligible for the full CTC before this expansion in 2021. If we could advance, please. Okay. Our research center was also keen to understand how the CTC payments affected other experiences of material hardship and factors related to family well-being that are also associated with food insufficiency. Data at the national level was somewhat limited, but we turned to a study that we run on poverty and disadvantage in New York City called the Poverty Tracker. So the Poverty Tracker is a longitudinal study where we interview a representative sample of New Yorkers every 3 months for up to 4 years. And it's the same households over time, tracking trends in dynamics in poverty and disadvantage, as well as material hardships and other forms of, other factors related to well-being. We adapted the Poverty Tracker surveys to specifically study the effects of the CTC on experiences of material hardship, use of food pantries, and parental labor force participation, among other outcomes. But I'm going to focus on these three right now and just show you what we found based on that study. So here we show changes in, oh goodness, oh no, you're good. I think some labels got a little lost in translation, but I'm going to walk you through these slides and it will make sense. So the first bar on the left shows the on average reduction in the share of families facing any form of hardship in the period after the CTC payments were made. And this is specifically focusing on families in New York City living in poverty. And when I say facing any hardship, what I mean is either running out of money before the end of the month, falling behind on rent or utility payments, not being able to see a doctor because of cost, or sometimes or often not having enough money for food. Now, we saw an 11% reduction in the share of families facing any form of hardship and a 23% reduction in the share facing multiple hardships. It's also important to note that the largest reductions in the types of hardship were concentrated among the share of families running out of money or facing food hardship, which are the bars on the right. So we saw a 22% reduction in the risk of running out of money before the end of the month among families with kids, and a 19% reduction in food hardship. Something that was resonated, or I thought was quite important about the finding regarding running out of money is it somewhat could be thought of as a precursor of food hardship, right? So it's offsetting possible later experiences of food hardship, and is where we saw a lot of movement. I also want to note that hardship remained widespread even when these payments were made, right? 63% of families with kids still faced some form of hardship when the payments were made. So we know that the CTC payments played a really important role in offsetting hardship, but need complemented by a holistic set of policies that address experiences of hardship among families with children. If we could advance. We also wondered how these payments affected families' use of emergency food assistance or food pantries. finding that on average, the payments led to an 18% reduction in the share of families using pantries weekly or more, which is the top bar right there. The effect on the share of families using pantries at all in the 30 days prior to being surveyed was smaller. And together, these findings, again, both show the power of the CTC payments, but the need for additional policies that bolster family income and offset food insufficiency and insecurity. And if we could advance. And lastly, as Megan mentioned, there was a lot of discussion about how the CTC expansion could have affected parents' labor force participation, with some arguing that parents would be less inclined to work when the payments were made. Alternatively, some believe that parents might actually increase labor force participation because they had more money, for example, to spend on childcare or to fix a car that might have been broken down. And in New York City, we find no evidence that the CTC led to lower levels of workforce participation among families with kids. In fact, we actually saw an increase in full-time employment, full and part-time employment, and in the number of hours worked in the period that the payments were made. Now, we can't say that these increases are the direct result of the CTC payments, but they do point to the idea that the payments did not lead to a reduction in labor force participation. Overall, the results I've discussed really underscore the benefits of the monthly CTC payments and how they contributed to factors that improve children's well-being. But as you know, as of January 2022, the payments are no longer being distributed, and Megan is going to discuss what's happened since then.
Yes, thank you, Sophie. So this graph here shows we've at the center, Sophie and our colleague Zach have been tracking monthly poverty rates since COVID began. This graph shows you from January 2021 up until just recently, this past May, about 2 months ago. And you can see the dark blue line is what child poverty looked like with all the different forms of COVID relief, including expanded food assistance, right, in different forms or fashion through SNAP expansions. The light blue line is what child poverty would have looked like if we didn't have this COVID relief in place. So even through 2021, you could see that different forms of COVID relief were keeping child poverty much lower, but you saw the biggest sort of gap between those two lines from July to December of 2021, when those monthly child when those monthly child tax credit payments were in place. And that's where you saw that huge reduction of anywhere from 3 to 3.8 million children out of poverty each month just from those payments. However, you can see with that dark blue line spikes up, unfortunately, beginning from basically the start of this new year, from January 2022, when those payments expired. And what it actually translated to was, between December and January, once those payments stopped, we actually saw an immediate increase of 3.7 million more children living in poverty in the start of this year than were in poverty at the end of last year. And we also see, of course, most recently, May being the most recent month we have available for data, that this line continues now to go up. You can see, obviously, there was a huge dip in child poverty rates in March, and there also was a dip in March of last year. That represents, tax time, basically, essentially when most families around the country would be getting some sort of refunds, hopefully, but if they're low and moderate income would get these refundable tax credits, traditionally things like the earned income tax credit, which could be, potentially a few $1,000s, depending on what the size of your family is and your income level. And in March of this year, you got that extra bump from the second half of the expanded child tax credit. Unfortunately, though, what we see is that, in terms of poverty reduction, it's very temporary. And what we see in terms of sort of overall hardship is that, even though families did get that extra refund in, March or maybe early April or something like that, it didn't necessarily help return us to where we had such progress on measures for poverty and hardship that we saw last year when the payments were being delivered regularly. We know from years of research on the earned income tax credit that when those types of big lump sum refunds are delivered just once a year, that families actually often have to end up spending it to pay back debt that they might have occurred the other 11 months of the year. And what we have seen in some research that, again, led by Zach and Sophie and other colleagues at our center that will be coming out with soon is we saw kind of a similar trend with this expanded child tax credit that families didn't necessarily use it, on food, and you didn't see food hardship drop again this spring. In fact, families were actually using it to pay back sort of, housing, rent arrears, things like that, and try and get themselves a little bit out of debt. And so unfortunately now you see that, households are struggling to cover their basic needs, which the child tax credit had been helping cover. But also we're seeing really, unfortunately, that food insufficiency rates are increasing. Research colleagues at the Children's Health Watch saw that, by February of this year, food insufficiency rates for families had jumped by 12%. That's pretty quick jump, just from being low in December. And the CNBC report represents a survey by the Parents Together group, who found, that about half of families with kids, half of their respondents, were unable to afford food for their family. And what you see is that in that survey responses that parents are reporting skipping meals to make sure that their kids are fed, or they're basically changing the types of food that they purchase. So less fruit, less veggies, things like that can sometimes be costly. So what the implications are here, and I know that this would be a very policy focused audience, is that, even though despite its name, the child tax credit is much more than just a tax policy, right? It actually ended up being, once it was changed to include more kids and be sort of, a good level of money that was coming in, and also crucially delivered on that monthly, that regular basis, that it actually became a really powerful anti-hunger tool as well. And so, when you are weighing in with your policymakers, or talking amongst yourself in terms of policy roundtables like that August event, or coming up with the White House Hunger Summit in the fall, the child tax credit can really be an important policy tool to complement the sort of traditional suite of nutrition programs that we often think about, because it's just functions, as we saw when it was in place, as a really sort of flexible tool that families can use to cover costs, which actually, to be honest, is much more, is even more timely now in terms of, inflation and increased costs that we're seeing, and that it can still play a real role. It wasn't just something that needed to be in place sort of on a temporary period just for COVID. But, there are opportunities. Congress has still kind of mentioned that there's some legislative opportunities for the child tax credit to potentially be resurrected in legislation, towards the end of this year. But in the meantime, what the federal expansion has done has actually really been an interesting point to help jump off other conversations for, it's not just the federal government that can do something like this, right? There's actually been a lot of really interesting stuff happening at the state level. I'll pass it back to Sophie just to conclude with some of that information.
Yeah, so as Megan mentioned, there's a lot of momentum at the state level to establish state level CTCs. Before 2020, actually only 3 states had a state level CTC that was somewhat tied to the federal one. But since then, 7 states have established state level CTCs in the more recent year, including Colorado, Connecticut, New Mexico, Rhode Island, and Vermont. And just an example, Vermont established a $1,000 child tax credit for every child under age 6 in households with under $125,000 in adjusted gross income. There are also advocacy efforts underway across the country to establish credits in other states, but paying attention to how these policies are designed and ensuring they reach the children who would benefit from them the most is really crucial to realizing the types of improvements in child well-being and reductions in food insufficiency that we saw with the federal credit expansion. But these efforts really underscore the growing interest and attention paid to policies that enhance families' financial security and reduce food insecurity and hunger in turn. So that's our overview.
Thank you, Sophie. Thank you, Megan. I mean, just a great summary and excellent look at the federal, and then a small look at the at some different actions that are happening across states. This is your opportunity now, whether it's in the chat or whether it's in the question and answer section. We invite everyone who's in the webinar to ask your questions of Sophie and Megan, and just to kick things off, because I don't see any yet there, which I'm looking for. I'm looking for, right? So I'm going to bring in another program that's kind of tangentially related, and that's SNAP benefits, right? And so can you talk a little bit about, because we're talking kind of about food hardship, and we saw an increase in SNAP benefits during the pandemic, and then we have just seen that also sunset. Is there kind of have you seen any kind of research or interaction between these two programs? I know SNAP benefits is really focused on food, right? And the CTC, its kind of end result was that people could afford to buy more food, but it was a serious hunger tool. But could you talk a little bit about those two programs and some research there?
Yeah, I can just jump in first to say that, when I put up that chart about what monthly poverty rates look like with COVID relief and without COVID relief, and you saw that the darker blue line was lower. So of course, obviously during last year, for 6 months, a lot of that reduction was coming from the child tax credit payments, but we also accounted for expanded SNAP benefits, either through the sort of, increase in benefit levels overall that happened at various points, but also the sort of emergency allotments that states could take up. And so part of that reduction, in terms of that blue line being lower the whole time, is actually due to, expanded food assistance. We had isolated the fact that the child tax credit on its own, say like by December was keeping about 3.7 million children from poverty, but actually the SNAP expansions were also keeping an extra sort of close to 1.5 million children out of poverty on their own. And that's, just on a monthly basis. And that's outside of what the child tax credit was doing. So together, the COVID relief by the end of last year, if you look at food assistance plus the child tax credit, was keeping more than 5 million kids out of poverty that would have been below the line otherwise. So they're really, really complementary, both in terms of, as a straight up anti-poverty tool, in terms of, increasing the resources that families have to spend on their family and their kids, but also then in terms of reducing actual hunger and what we see in terms of food insufficiency rates and things like that. So, I think they really can very much work hand in hand. And at times when say, because already towards the end of last year, food prices were rising, right? So it was helpful to have something like that flexible child tax credit payment to be able to step in and supplement family food needs. At other times when maybe SNAP is doing, is able to do, good amount on its own, having something like the child tax credit can be used in other ways in family budgets and then take the pressure off other areas, maybe housing costs or transportation or childcare, what have you. So it very much can be a really helpful supplement, not just to family incomes in general, but a really helpful supplement and complement to the whole host of safety net programs that we have, because it can be used so flexibly. But Sophie might be able to add more about just sort of other pieces of research or anything like that.
No, I mean, I think you summarized it perfectly. And I also think that important complementarity is key. And the need for cash-based policies that allow families to then, like you're saying, use fungibly as needed in response to, economic challenges that they confront. We did qualitative interviews with New York City families who received the payments, and that's what we heard time and time again. Like November it was spent on food. In October, it was spent on keeping up with rent, a car repair in September. And that flexible nature is really key, particularly as so many things in the economic landscape are changing. That flexibility is key.
Yeah, and I think the flexibility part of it, nutrition sensitive, right? It can, basically if you don't have a car and you live in a kind of an area without grocery stores, it can be very difficult. And so even if that spending isn't on food directly, right, it is actually helping in procurement or food. And just the sheer reductions are staggering, right? Millions is a staggering number. Millions of families with children, right? Could you talk a little bit more about those kind of being unable to reach the kind of the folks that may need it the most, right? Because they're not actually, they don't have to file a federal tax return, and so they're not really in that system. Could you talk a little bit more about how many? Do you know how many were kind of missed, right? And some other ideas about how you could do that. And I know we saw that with the stimulus checks, right? So maybe there are some learning there, but if you could expand a little bit on that, if you could.
Yep. I can start. So basically, it's actually been like one of the biggest questions that we've been wanting to nail down is actually how many people, like specifically. We have ballpark figures, but it is actually something that is one of the things that in terms of learning for next time, like having more concrete data on who might be missing out, and then you can develop outreach strategies and of course around that. But in terms of what we knew, so if families had filed a federal return recently in the last year or two, they would automatically get it. The IRS would just use the information that was already in the tax system and start sending out the checks, similar to the way that the stimulus checks worked. Some colleagues at the Center on Budget and Policy Priorities had identified about 4 million people would probably be missing out on automatically getting it because they either, just weren't in the system for various reasons. And it happened to overlap with that they might have characteristics like health challenges, potentially maybe unstable housing or homelessness, even just like, they might not have internet connections, like all these types of things that then kind of compound some of the challenges of that they're not automatically getting it. And but they also might have some barriers that make it harder to try and figure out how they should get it, or even actually to just know that they were eligible because this was totally new. And so, I think, we know, and I say we as in a collective, we probably everyone on this sort of audience knows that just from experience with all sorts of other programs that information sharing, enabling information sharing behind the scenes, of course, in ways that protects, privacy and data, but in ways that sort of makes the user experience for families who are coming in and trying to understand what they're eligible for in a way that makes it easier for folks to apply and stay eligible and things like that, is the way to go, like should be the way of the future. There were efforts, to try and set up sort of what they called were portals. Like, so if you hadn't filed taxes recently, the sort of jargony term would be like that you were a non-filer. And so they tried to set up, the IRS did set up a non-filer portal where you could go online and enter your family information and income information and try and get registered for the child tax credit that way. Other groups came in, like Code for America, who try and help technology-wise with getting folks connected to benefits, set up like a more user-friendly getctc.org. But again, all of this, the analogy that many people have used is that it was kind of like building the plane, like as we were flying it, because it was a very quick rollout, and also that the payments were only in place for 6 months. So, getting all of these systems up and running, a lot of technological improvements actually happened towards the end of 2021, but then the payments were only in place until December. So it was like very frustrating for like so many hardworking people who had been actually also boots on the ground, not just just technology behind the scenes, but knocking on doors, trying to go to communities and put up flyers and have community events and say, hey, you're eligible, like don't miss out on this money. But the window was tight in terms of timing. So there have actually been a couple of really great reports. They're like 100 pages long, but like for practitioners who want to know for the future, like some really good learnings that came out of the experience of trying to get folks connected. There is now like a body of real world evidence. And so my hope is that if, this policy comes back in some form or fashion, hopefully in the near future, that we can maybe implement some of these to try and get folks just a more streamlined experience to making sure they don't miss out on the payments.
Great. I mean, so first of all, are you hopeful that a federal-based system could come back? And then drawing in Morgan Day's question about, what are some tactics that might be useful to see kind of CTCs being enacted, in other states. I'm not sure if you're experts on kind of that, but maybe you can speak a little bit to that. It seemed like, Massachusetts, Rhode Island, it seems like some eastern states and some states that are generally run by Democrats, but it is a tax credit, so it could be very bipartisan. But talk a little bit about getting it enacted across different states in that way.
Just very quickly, I'll pass it to Sophie for some more information on the state piece. But I personally am hopeful that, a federal policy will come back again. Like I honestly have no clue on the timing. Like I think everyone wishes like they could know, like, would it be back in place, by the end of this year? Will it take longer? Like, of course it's unknown. A lot of it is up to just, larger things at play with Congress and things like that. But I think that we've seen while it was in place, that it made such a huge difference. There's a real body of evidence now to point to. Families actually had really positive experiences, the ones who received it. There's also evidence, that this was helpful to families and they were happy it was there. We've seen a huge growth and explosion in just of people who now actually support the bill, like in terms of policymakers. And it's not just Democrats necessarily at the federal level, even though the expansion itself, of course, was part of a larger package, that was primarily enacted by, the Democratic leadership in Congress and the presidency. But at the same time, you have seen Senator Romney recently, just about, within the last month, has introduced, his version of basically what would be a child allowance, structured slightly differently, and that it would go through the Social Security department. But that's fine. You can, once you're actually talking about differences like that in terms of how it's technically structured, you've sort of accepted the premise that this is a very helpful policy idea. And so I think that shows that we have actually made so much progress in terms of, you can debate, of course, absolutely. And that is the role of Congress and the different parties to debate how a policy looks in terms of the nuts and bolts. But I think it's really moved the needle in terms of actually showing that this idea of having sort of regular payment made out to families with flexible cash that they can use to support whatever their particular family needs are, and that it should be widely available to, almost all children, closely universal idea. That's something that shows that I think, it may not be tomorrow that it comes back at the federal level, but that we're sort of on our pathway to it in some form or fashion. But there is a lot of exciting stuff happening at the state level in the meantime. So Sophie, you probably know a little bit more about some of those situations.
Yeah, I think in terms of the specific tactics, it's obviously somewhat varied by state, and don't have the best way of summarizing what I know about those. But what I do know is how research and data has been played into those tactical agendas. So we've seen in states more of a focus on the high rates of child poverty within states and the role of state governments in combating that. And it's also the fact that those high rates of child poverty are then correlated and affect all of the other systems that states are operating, their departments of education, health and human services, right? And so it's kind of thinking about not only is the high rate of child poverty within a state affecting children, it's within a specific year or time, it's affecting their long-term trajectories and the health of your state population. And I think that is compelling to certain state actors or state governments. And something that has also been really useful in our discussions about the possible impacts of the CTC federally and at the state level is acknowledging that the data showing that the direct costs of these types of programs, those costs are completely eclipsed when you look at the broader societal benefits that come from these policies and the dollar value associated with those societal benefits, particularly in terms of improvements in children's health in the long run, their long-term employment and labor force participation, their reduced spending on the child welfare system and such. So these are some of the data points that we've seen have been important at the state level. And the key finding from that benefit kind of cost analysis is that the societal benefits outweigh the costs at a rate of 8 to 1. So completely, outside of the, kind of ballpark in a way. So those have been the data points that we've been focusing on. We have a report on the potential anti-poverty impacts of different state level CTCs that we'll share. It's from a few years ago. We're working on launching a new set of analyses, answering a similar question, and we'll keep you all updated.
Yeah, I have a question from Emily, and she I think this is really about implementing the policy and the different kind of policy levers. But she says, do you anticipate all three components would be included in future versions, meaning increasing levels? I think meaning levels, the amount of money, expanding access, and then monthly installments. And then she says, is there one that's most beneficial, or all the elements should all these elements be included together? So
Megan, I can start. So in kind of, what's the most effective, it kind of depends on what you're thinking of the outcome is, but in terms of child poverty reduction, the most kind of important component of that expansion was expanding access and making the credit fully refundable, which meant that low and moderate income families were eligible for the same same credit levels as middle and high income families. Without that, you're really not reaching the lowest income families in the country. And so the effects on poverty are really diminished. And we've done some work. Megan has really led some work looking at the how family size is related to access to the credit and how much money you need in order to qualify for the full credit, depending on the number of kids you have. And I remember what it is for a 2-child family. I think it's about $30,000 in annual earnings to qualify for the full credit. But Megan, you might know off the top of your head.
But then if you have
bigger families,
so it's about $30,000 if you have 2 kids. But if you actually just, add a third child to your family, then you all of a sudden need to earn $36,000 in order to, for 2 children, you need $36,000. If you add a third child, you actually need $42,000 to then all of a sudden just keep getting the same level of credit that you should have gotten beforehand. If you happen to have 4 children, you need to earn close to $50,000 in order to keep accessing the same level of credit. And so it's just the way that, the idea of a tax credit being refundable or not refundable or partially refundable can get very sort of technical, but the idea is just basically are you actually knocking people out of being eligible based on how much they're earning? And what this does is it disproportionately, knocks out people who have lower levels of income. And so what you see then is what we've returned to now. So Sophie and I talked a lot about what this looks like, you know, what the eligibility looked like when it was expanded. But actually, you know, today, like as we're speaking to you, the credit has reverted to its pre-expansion parameters. And so actually you're back to that situation where with each extra child you have in the family, you actually need to earn more money in order to keep getting the full credit. And we of course know that like you don't magically all of a sudden earn more money when you have more kids. That would be nice, but that's not what happens. And so it's really just, you know, disadvantaging kids themselves who, you know, have no control over where they fall in the birth order. And all of a sudden, if they're the third kid, their families, you know, may actually get less child tax credit than they were when they only had a smaller family. And what we're seeing now, of course, you know, you could have a higher benefit level. That would be great. But actually, if you don't include those kids, you know, who are left out by the refundable piece, then, you know, you're actually just still giving it to middle and high income families, which is actually now the situation we've reverted to. You know, a married couple all the way up to, is it $400,000, can actually get the full child tax credit for their families. But, you know, families below $50,000, you know, depending on how many kids they have, might only get a very small fraction of that. And, you know, I think, you know, kids are the first ones to point out like whether something sounds fair or not fair. And like, it just doesn't, it's not very fair. And so that refundability piece and access is really important, but also delivering it monthly. If you want to hit other markers, families spend it differently when it's delivered monthly rather than when it comes once a year. And in terms of what we've seen in terms of food access specifically and healthy food access, fruit and veg, stuff like that, that monthly piece would probably be number 2 kind of on the list.
I just wanted to speak a little bit about your longitudinal study. I know I wanted to keep this short, but I'm having a good time asking you questions, right? Are there plans to kind of expand out doing a longitudinal study? I would imagine it's quite difficult. But that longitudinal study was really quite interesting in showing those those reductions, and I think they're very important. Or are there other groups? I would imagine there are doing those types of longitudinal studies around the country.
Yeah, so and yeah, there are challenges, but we have an amazing team that that makes it look easy. But no, it is a challenge, but we collect a wealth of data and that you really can't find in other places because of the study and the data that we have. But so there have been, there are some other studies doing similar things. And if anyone's interested in launching something similar in their local area, state, or what, please do contact us. It's always something we're interested to talk about with people. In the San Francisco Bay Area, there's a study run by Turning Point, which is is an organization similar to the foundation that runs the poverty tracker alongside us and partners with us, named Robin Hood. And I can send out the information for Turning Point. But yeah, it's kind of it would be great to have this type of information across the country, and yeah, it's something unique to our center, really.
Yeah, I mean, I think it's very interesting, and so I hope that there are people who are interested in doing that, and in some other places other than San Francisco and New York City.
Yeah.
Really, and I'm sure there are, but it'd be very interesting. And lastly, as you know, as kind of researchers and policy folks in kind of the poverty realm, right? We're kind of now seeing increases in inflation, right? Increases in food price, which is inflation. But really, what do moving beyond kind of the child tax credit, what are you looking at now, or what are you looking at going forward related to this kind of very, I would say, challenging environment that people in poverty are facing?
So Megan, I can.
Yeah.
Okay. So you're right. Obviously, food prices and increasing food prices are affecting everyone, but are most acutely felt by low-income families across the country. Something we have been doing is thinking about how inflation intersects with the different anti-poverty policies in place at the federal and local level or state level. And I don't mean to go too back to the CTC, but using the CTC as an example, right? A $300 CTC in July of last year, just 1 year ago, has a different value than it would today because of the high inflation rate. And so you can buy less with it. And so it actually is a good example of how benefits levels need to be tied to inflation in order to keep up their impact effects, the way they help families. A federal minimum wage is an example on the opposite end of the spectrum, right? It was set at a certain level, has not been inflation adjusted, and has just fallen over time. So we have some work upcoming that's looking specifically at this type of question and how benefit levels are tied to inflation or not, and what the potential impacts of variation in that policy design could have.
Great. I just want to thank you both, Megan and Sophie, and thank your center at Columbia, and just a wonderful webinar. And I want to thank all the participants as well. And for everyone who wrote a question, thank you very much. I really appreciate it. I was lucky enough to get to ask more of my questions, which is always fun for me. Just to finish up here, I just want to put these things again on your radar, right? August 2nd at noon Central Time, we will be having a listening session associated with the White House conference. There we go. Thank you, Ashton. On the White House conference on hunger, nutrition, and health. So that will be on the 2nd. I think we already have 25 people signed up for that, which is phenomenal. We'd love to have more. And really what that does is it feeds into this, well, now kind of once in a lifetime conference, because the last one was in 1969 during the Nixon administration. So just it's really your chance, and there are a lot of listening sessions out there that will feed into the conference, but that will be on August 2nd. Secondly, Paths to Zero, the Iowa Hunger Summit. It's the 16th anniversary of the Iowa Hunger Summit. September 1st, it will go all day long. It'll be virtual. We're going to have some amazing sessions there. And so this webinar was the start, and we're kind of moving towards the Hunger Summit. And Path to Zero really is something that we want, we want to get to zero hunger, right? We want to greatly reduce non-communicable food-related disease. And so out of the summit, we want to see some of those paths, right, to those areas. And in Iowa, we have significant levels and increasing levels of hunger right now, and increasing levels of non-communicable food-related disease. And so we've got some ways to go, but actually the Child Tax Credit, the expansion of the Child Tax Credit, and the massive impact that it had, kind of shows us these kind of flexible, nutrition-sensitive policies that could get us there. And lastly, I have to plug Feeding a Fragile World, the Borlaug Dialogue, which is 18th to 20th. Please register. So it's free for everyone in the Global South, all students, and people who are Indigenous or in tribal communities for the virtual event. And then we will be having people in Des Moines October 18th to the 20th. It's going to be a great time. Thank you so much, Sophie. Thank you so much, Megan. Thank you so much to the Center on Poverty and Social Policy. And I want to just say bye-bye. All right.
Thanks. Thank you so much.
Thank you.